I literally held a man's heart in my hands. Hey guys, welcome back to my channel. My name is Anu and I'm a third year medical student at St. George's University. Almost fourth year, guys. If you're new here, please go ahead and hit that subscribe button. If you're not new here and if you have still not subscribed, please hit that subscribe button. It's a new year. Let's, change for the better this year. Anyways, so let's get into the video, guys. Today we're going to be talking about surgery because I just completed my surgical rotation recently, so I'm just going to be telling you guys all about it. For me, surgery was 12 weeks long. I don't believe it's like that for every single school, but St. George's University makes its students do 12 weeks of surgical rotations. So I did my rotation in Jersey City and we basically did 4 weeks on the general surgery floors, and then the other 8 weeks were in other subspecialties. 1 week in outpatient, 1 week in CICU, 1 week in anesthesia. We had CT surgery as well. Other subspecialties, ophtho, all of that. For me personally, I completely enjoyed the 4 weeks on the floor. It was exhausting, it was tiring, but I feel like that's where I learned the most this rotation, just because the residents included us as part of the team. I guess I'll just tell you guys how the days on the floors went. So actually the floors were divided into 2 parts. So you had 1 week of nights and 3 weeks of, day shift. So you wake up, well, whatever time you wake up, depending on where you stay. We had to be there by 5:30. So we were 4 students during my rotation and we kind of divided it up amongst us. So 2 people would get there at 5:30 today and then the other 2 would get there by 5:30 tomorrow. We had to be there at 5:30 to write out the labs for all the patients before the residents come to round, and then around 6 we round together, walk-in rounds. Usually that lasts about an hour, and then after that we would go sign out with the 9th float team. From there you basically would get assigned either a patient or oral duties, or wound care duties. Our main jobs were to be in the OR or to be liaising between the nurses and the residents, or to go help change a wound vac. I learned a lot about wound vac changes and how to care for it and how you use it and how you replace it. I think wound care was such a huge part of surgery for me that I kind of fell in love with wound care. Yeah, we were just included as part of the team and you could tell that our opinions were valued, and that's what you want in a good rotation. And usually the day would go up until maybe 6 p.m. So it was basically like a 12-hour shift. And then they will let you go sometimes 4 p.m. So between 4 p.m. and 6 p.m. I know people who have stayed later. I think the latest I ever stayed was maybe 8 p.m. because I was in a surgery that ran a little bit late. I have a couple of friends who that happened to as well. Just be prepared. It's surgery, things happen. The OR times on the board are never going to be correct. If a surgery, I think the only correct OR time in the day is the first surgery of the day, and then everything else is just up in the air depending on what happens in that surgery, or just how the surgeon is feeling or things like that. So it's very dynamic. You have to be on your tools a lot, which I think makes it interesting for some people. For the other specialties, it was a bit more relaxed in terms of you didn't have to come in at 5:30. Some of them would be 7 a.m. not p.m. 7 a.m. like CT surgery. CT surgery was actually really cool because I'm interested in internal medicine, and one of the things I'm interested in internal medicine is cardiology, possibly. So CT surgery was cool for me. I guess our job in CT surgery, well, I had the opportunity to hold a heart. I literally held a man's heart in my hands. It was really cool. I held the heart while the surgeon sewed the vessel, anastomosed the vessels together. So that was cool. What other things? Urology was nice as well. All the outpatient ones you probably would have to get in around 8 or 9, so you could sleep in a bit longer, or get things done in the morning. So that was nice. You have 4 intense weeks of general surgery floors, and then everything else is just a little bit better in terms of timing. Yeah, nights were cool as well. We would do, I think, 18-hour shifts, so from 3 p.m. till about 8 9 a.m. the next day. You guys can do the math, I refuse to. And nights were amazing because it was literally just you and one other resident, and so basically everything is up to you and the resident, of course. And so you just get more opportunities to do things. If you would like to learn to suture, that might be, you know, the right time to ask, depending on how busy the night is, of course. You get to do the ED consults, taking histories, the physical, you know, all that. If there's nothing going on, of course, they would send you to sleep, which is always a good thing. But then you'd have a pager on you. Another thing that I found interesting during my surgery rotation, and if you watched my CQ video, you probably know what I'm about to say, is the traumas. So the hospital I was at was a level 2 trauma center, so we got a lot of traumas. I know in my CQ video I was kind of sad because I didn't get to see one that week, but I got to see plenty in the 4 weeks I was on the floor. Traumas can be anything from, you know, stab wound or gunshot wound, or just, you know, insane exciting things coming. Sometimes not so exciting, like, you know, an older person falling, which it's dangerous, but, you know, it's not as exciting as a gunshot wound, for example. So learning the ABCs of trauma, how to work up a trauma patient, when do you do a CT scan, when do you not, you know. I actually learned how to do a FAST exam, which was really cool. The FAST exam is basically like an ultrasound that just checks for fluid in the abdomen, and I believe you can use it to check for cardiac tamponade as well. I didn't see it get used in that way, so that was fun. I got to scrub in on an X-lap of somebody who came in through the ED as a trauma patient and just went straight up to the OR because of the nature of the injury that the person had. So that was really cool. Also, with general surgery, you see a lot of lap choles, a lot of lap appendectomies, you see a lot of colectomies. One thing I would recommend to do is, I know there's this app called Touch Surgery that literally shows you videos of the procedure, so when you're in the OR you're not lost, or if the surgeon decides to ask you a question, you know exactly what it is that you need to say at that point in time. Or you can just YouTube videos of lap chole, for example. And Pestana's notes, Pestana's surgery notes are also really helpful. So if you can get your hands on that, get a digital copy, a physical copy, whatever works for you, that really helps as well. Let's talk about the surgery shelf preparation now. I actually just wrote my surgery shelf last week. So for a surgery shelf, obviously do your obvious ones, online method videos, make sure you watch those. Although for me it was a bit of a struggle this time around watching online method. I don't know why, but I forced myself to do it. I guess I don't like just sitting passively and just listening to information being given. It doesn't stick well to me that way. But yeah, online method, very helpful. Another one I would say is helpful, obviously, is your UWorld. UWorld is always helpful. Make sure you at least finish it once and try to redo your wrong ones. Take notes while doing UWorld, of course. And a couple of days before your exam, or a week before your exam, I would advise that you watch Divine Interventions videos, because it does such a good job of reviewing the entire surgery rotation and giving you high yield material that will come out on your exam. Emma Holiday's videos are also really good at that. If you don't have time to watch the videos, make sure you look through the slides. I was looking through the slides on the way to the exam hall, you know, and some of the things that I literally just, you know, picked at last minute actually did show up on the exam. That was Divine Intervention. So make sure you do that, and yeah, you guys will probably be fine. Honestly, surgery was fun. It was tiring. It was exhausting. It was all the things. Now I can say I successfully know how to take out your gallbladder if you ever need me to. Although I'm not sure you would want me to, but you know, just in case you ever needed me to, I got you. Okay. Yeah, that was it. That was surgery. Anyways, guys, thank you so much for watching today's video. Make sure to subscribe and like this video if you have not already. I'll see you on the next one. Bye, guys.